The Bonati Spine Institute treats a wide variety of spine disorders, including pinched nerves, bone spurs, bulging, herniated discs, sciatica, and more. Board-certified Bonati orthopedic surgeon Dr. Peter Godletsky joins us to discuss the case of a patient, Wilson Rodriguez from Orlando, Florida.
Mr. Rodriguez had back pain going on for several years, and it worsened over the past year or two. He came to us for evaluation and examination to see if there's anything we could do to help him. He had already had considerable amount of treatment, including chiropractic care, physical therapy, epidural injections, medications. He had back pain and pain radiating down the leg on the right side. And the x-rays showed some wear and tear at several spaces. At these lower spaces, there's some bone spurs coming at the front here, which you can see on each level. That's actually nature's way of trying to fuse these areas over because it senses that there's injury there. Your body senses that there's injury, and it tries to actually bridge and fuse these over. So he had some of these spurs indicating there were some long-standing changes or problems in his back. That doesn't happen overnight. Patients have a lot of pain.
Wilson sat down with us the day of his initial consultation to tell us about the pain he was experiencing and the particular incident which made him seek out a more permanent treatment.
When this happened to me last week, it felt like somebody opened up a bottle of pain inside me. I froze like for 10 minutes, so much pain. I was actually in tears, you know? So I was too scared to move, so I just stood there and just waited it out. The whole day was messed up for me. And until now, it's still messed up. But I just have a lot of pain. I don't consider it by numbers. I consider it chronic, agonizing. I woke up 3 nights. I probably woke up my neighbors. I woke up screaming.
To better understand the severity of Wilson's condition, Dr. Godletsky goes on to provide a thorough explanation of his x-rays and MRIs.
We're also looking to see is there any tumor or infection or any other spinous problem that would account for his symptoms. We don't see that in this situation. MRI scan is done next to determine if there's some pathology and what we can do about it. In this case, we can see from a side view MRI, as we're taking the patient standing sideways and we're slicing into them. So these two up here are pretty much exactly normal. These are what we all wish we had at every level. They're just perfectly normal discs, look real good. Down to the next level, also pretty good, but has a little piece sticking out down here to the bone. That's a normal anomaly, but nothing is sticking into the back. Now, if you look at what's wrong with this picture, you can see. So there's a straight line coming down here, and then there's a dimple coming here. So the disc is pushing out here, pushing out here, and pushing out here. They're actually called herniation when it goes out and extends past the borders of where it was before. We see that also on here a little bit more, which is a side angle view. You can see a real good one right here. There's a large chunk of stuff in the back here. There's a little bit here, and there's a large chunk here, where there's none at the other levels up above. So in this case, we were quite certain that there was at least changes at the numbers. The vertebrae are numbered. So these are numbered of the lumbar spine, 1, 2, 3, 4, and 5. That's the lumbar spine. That's the part where you bend, and your low back where you bend and move. The sacrum is down here. That's your pelvis, which is stable and which doesn't move. There was protrusion of disc material sticking out the back. Now, you can say from this view, is it out to the left or the right? Well, I don't know because I can't see. This is a cross-section view, so we take these what are called axial cuts, which are now cuts taken straight through the person looking down. We're not cutting them, of course. That's the reformat of the MRI machine. So, so here's a representative sample of probably the worst level of the herniation in this case.
Simply by looking at Mr. Rodriguez's MRIs, Bonati spine surgeons were able to pinpoint exactly the source of the problem causing his symptoms.
Each nerve goes to a specific area in the leg. So that's all been worked out by years and years of research. We know that as in this case, the lumbar 5 nerve goes to a specific area on the leg in general. It overlaps a little bit, but generally goes to one area. So we know if we free up that nerve completely, we can hopefully relieve pain to that nerve. Back pain is a different thing. There are several things can cause back pain. What we do at surgery, if the patient has had trial of all these conservative measures and they're still persistently painful, we address all of that at that level. By that, what I mean is we want to decompress and free the nerve that's going out here, free and put a space so that the disc does not be pressuring onto the spinal canal or onto that nerve, and free the nerve above, the nerve below, the floor below, and the roof above, so that there's all plenty of room for the nerve and the spinal canal to cross without causing any pressure. With this, we found good results, and that's been the surgery we did, same as on Mr. Rodriguez.
The patented Bonati spine procedures are unlike those offered at traditional hospitals or those that claim to be minimally invasive facilities, since Bonati's procedures are performed using conscious IV sedation. Dr. Godleski explains why this methodology is both unique and beneficial for the surgeon and the patient.
This surgery is done under local anesthesia, meaning we don't put the patient under general anesthesia. There are several reasons for this, and they're good reasons. One is we don't have the complications of general anesthesia, such as breathing difficulties because you had a tube down, cardiac, blood pressure, different problems that can happen from medications given for that. So the patient is getting just injection of a Novocaine type of anesthesia. So, similar to when you go to the emergency room and you get stitches. So that's about the trauma that it is to your body. Nonetheless, then we put a tube down through that area, and we're working with the full up and down and sideways and to the left and to the right. We're working in a full area down there, but through a small tube, sort of like doing a ship, building a ship inside of a bottle. We're doing the whole procedure, but through a very small opening. Reasons for that. Number one, while the patient is awake, they can tell us if we're in the area where their pain is. Once we have that nerve cleaned, above, below, from left to right, we then ask the patient, we touch the nerve and ask the patient, do you feel the pain? Because if we touch that nerve, they should feel the pain going to their leg as we had thought. If they say, no, it's a different area, then something's wrong. We have not relieved the site where the problem is. Secondly, while we're doing the surgery, this is done very meticulously, a few millimeters at a time, chipping away and clearing all the bone. If we're in the wrong area or touch something wrong, the patient can say right away, ow, and we know that. Not to wake up after the procedure and then say, oh, my leg doesn't work for some reason. So we know immediately if we touch something and then we'll readjust or whatever we have to do. So safety is one of the main reasons, and to reproducibly find the source of their pain. At the end of the procedure, then also the patient's awake and we ask them to move. Sometimes we'll have them get up on their arms and on their hands and knees, have them move their back and say, is your pain gone? Is it still there? Can you feel it? If it's still there, we'll go in and look again and try to determine where the cause is. So the local anesthesia provides safety and also provides accuracy for us to get the patient better the first time.
Wilson sat down with the Bonati team after his procedures to describe his surgical experience and his time at the Bonati Institute.
I thought it was great. I told my friends, and I told them that I'm actually seeing my surgeon. I'm seeing the surgery, and they couldn't believe it. I thought it was incredible. So I really do think that what they do, they keep you up, they numb you. I think it's important because it's just like the doctor told us. We're really directing them. When they touch certain places and it hurts, they know what to do. I'm humbled by this experience and I feel great. If I do need another surgery, this is the place I'm coming to. And I live 2 hours away. Every mile was worth coming here. Every time I came here was worth it, you know? So, oh yeah, this is great. I feel great.